Hi, my name is Christina. I'm your nurse today. I will be performing a head to toe assessment. This provides us a baseline into your health. I do see here that you do have a few friends or family members. Is it okay if they step out or would you like them to stay? You want them to step out? Okay, well, they step out and I perform um, privacy for the patient. Um, at this time, I'm going to perform hand hygiene. Okay. Um, Minnie Mouse. Uh, Minnie Mouse, can I get your name and date of birth? Perfect. Is it okay if I address you as Minnie? Yes, okay. And Minnie, can you tell me where we're at? Yes, that is correct. And Minnie, can you tell me who the president is? Yes, that is correct. Okay, Minnie is alert times 4, as she does know her name, date of birth, um, place, and current events. Minnie Mouse, I am going to start from the head down to your toes. Meanwhile, while the patient is answering, I am assessing for symmetry in her face. Um, in her hair, I am going to go ahead and inspect and palpate of the head and scalp. Basically assessing symmetry, shape, size, um, head in the head and the face. I am making sure there's no drooping in her face. I'm gonna go ahead and assess her cranial nerve number 4 by asking her to smile, by asking her to frown, by asking her to puff her cheeks, and um, I'm gonna go ahead and I see that those cranial nerves are intact. In her hair, I'm gonna check for color, quantity, distribution, texture, shape. I'm gonna make sure there's no infestation, there's no masses, there's no alopecia. Um, let's see here. That's what I'm gonna check in her face. Since I'm already here, I'm going to check her temporal arteries. The temporal arteries are inspected bilaterally, and she has a 2 plus, which is good. As I'm also here, we're going to go ahead and check cranial nerve number 5. Can I ask you to bite down? Okay, and I'm going to, in the meantime, feel the mastoid muscle. Okay, then the temporal muscle open. I'm going to ask her to open her mouth again against resistance, like so. Next, I check her temporal mandibular joint, open and close mouth. Check for grating, clicking, and any sensation, any abnormal sensation. Since we are here, we're gonna go ahead and we're going to look at her eyes. Let's go ahead and start by palpating sinuses, um, the frontal and the maxillary sinuses. So if you do feel any discomfort, any pain, please let me know and I put pressure on it. Next, since I'm here, I'm going to look at her eyes. I'm going to look at her sclera. Does her sclera look wide or on the eyes, or is there any um, jaundice, any erythema? Is there any swelling in her eyelids? Her pupils, I'm going to check her pupils. I need to make sure that they're equal, that they are anywhere between 3 to 5 3 to 5 3 to 5 millimeters. That would be normal. No strabismus, no anescosia. So I'm gonna check with my eye. We're gonna pretend this is my pen light, and I'm gonna go ahead and check. Um, First, let me check her conjunctiva, and we're gonna go ahead and make sure it's nice and pink. Next, we're gonna go ahead and check for Next, we're going to go ahead and check for nystagmus. We're going to ask her to follow the pen, going to the 6 cranial fields. And if you could go ahead and follow my pen, and we're going to go ahead and do this. Okay, and the pupils are gonna we're gonna check if they are reactive to light. So what we do is typically we will dim the lights, and next we would with the light we would go like this and put light into one eye, and we would expect both pupils to react to become smaller. Typically, if they're three, we kind of expect them to go down to a two or one. Okay, and now after that, we do that to both eyes. We test for accommodation. We put a pen about 14 inches of far away. Okay, and and we move closer to it. Um, okay, and what we're supposed to see is her. They accommodate. Um, so move pen towards the nose, and they will go ahead and accommodate. Now, after this process, we have Perla. Um, Pupils are equal, round, reactive, and accommodate. Okay. Since she has such big ears, we're gonna go ahead and now check her ears. Okay, her ears. First, we inspect them. The ears look. The ears need to look normal. Any abnormalities would be redness, drainage, um, redness, also accumulation of discharge called tophi. Um, Next, we would palpate the ears, and of course, please go ahead and let me know if you do feel any any if you feel any discomfort. Okay, um, we're gonna go ahead and palpate the master process back of the ears. We're gonna now use the otoscope for tympanic membrane. Okay, that is a pearly gray. In your right ear, you should see it at the 5 o'clock. In your left ear, you should see it at the 7 o'clock. And what you're looking for is a pearly gray, transparent, shiny color inside the ear. And for that, you're going to go ahead and pull the pin back, pull up, and then back. Okay, now we're going to check for, now that we have done that and they look correct, we're going to go ahead and check cranial nerve number 7. Cranial nerve number 7, we would do it like this, cover her ear, and then go pink apple. She heard pink apple, which is what I said. Pink apple. The yellow banana. This time I said yellow banana, and she heard yellow banana. So she is good. And do you have any pain in your ears or anything like that? No, she does not. Okay, so let's go ahead and move on to Minnie's nose. Okay, here we're going to go ahead and let me just perform hand hygiene again. Okay, and we're going to go ahead and inspect the nose, and if it's midline, we're going to go ahead and see if she has any deviations, if she has a deviated septum, anything obstructing it, any drainage. Do you have any drainage, any complaints about your nose? No, Minnie, that's great. Okay, so what we're going to go ahead and ask her to do is we're going to go ahead and ask her to close one nostril, then breathe. Okay, and then we're going to go ahead and ask her to close the other nostril and then breathe. And that's a nice airflow, nice patency. She's good, no deviation there. We're going to go ahead and look inside her nose. And at this time, where she's good. And then we have to check cranial nerve number 1. And we're going to go ahead and ask her to smell something. And I have something right here where she's going to smell it. And I'm going to ask her to close her eyes. And she's going to smell it. And she says, oh, yes, I smell lavender. And we know her cranial nerve number 1 is intact because it is lavender. Okay, now that we have done that, we're still here in the face. We're going to go ahead and move on to the mouth. We're going to go ahead and inspect the lips. We're going to go ahead and inspect the lips, that they're pink, they're not blue, as that can be a lack of oxygen. We're going to go ahead and inspect that they're not dry, that they're not cracking, because they could be dehydrated. But Minnie is pink. Okay, and here we're going to go ahead and check her cranial nerve numbers 12. So we're going to ask her to stick her tongue out, move it side to side like that. Look inside her cheeks for lesions, for teeth cracking, for any abnormalities. We're going to ask her to stick out her tongue and lift it up, as that's where mouth cancer can typically be at. Also, while here, we're going to go ahead and make sure we're going to ask her to stick out her tongue, go, and we're going to make sure her uvula is in the middle. Right here, we're also going to go ahead and check cranial nerve number 9. And we're going to test the gag reflex. And Minnie Mouse does gag. She has good cranial nerve number 9 intact. Now we're going to go ahead and move cranial nerve number 10. Is able to, when she talked, when she was able to talk with us, so we're assuming cranial nerve number 10 is intact and she can swallow. Okay, so we are moving on to her neck. Now, just again, perform hand hygiene. If we had gloves, I would put on the gloves again. But, okay, here on cranial nerve number 9, we're going to inspect the trach, that it is midline. No, now we're going to inspect the trach, that it is midline. Get out of my room. We're going to make sure there's no... Can I pause this?
No.
Can I pause this, Sophia?
You could stop it.
Is it stopped? It's not stopped.